So hello, I'm Sue Cutshall. I'm an integrative health specialist in the Department of Surgery, also a surgical coach, so I often see patients that are either anticipating surgery or they're in their process of recovering for surgery. So what I'm going to talk about is just kind of a few tips that may help you as you're preparing for surgery or thinking about transplant and your recovery. So the first one I'd like to discuss is probably kind of the big priority is as you're coming for appointments either before or after transplant, just having a piece of paper or a journal with you so you can kind of write down some of the thoughts or the questions that you have. Often things get very rushed or busy and sometimes we forget to ask some things. So if you can think about that ahead of time, that's wonderful, and then you can also write down some of the things that service or other people have had to say so that you can remember that afterwards. So that's probably the number one tip. Number two is probably thinking also about your caregivers. Very important to have caregivers with you as you're coming to appointments, as well as you're getting ready for transplant, and certainly and during your recovery after transplant as well. As you're thinking about preparing for surgery, even getting together with those caregivers and really thinking about what are some of those needs you might have during that time so that you can have that open discussion and everybody knows what the expectations are. It may seem kind of weird to do that, to get together with that, but it's kind of a nice way to kind of keep that connection as well. And then if we look at other things as you're preparing, getting yourself in the best physical condition possible to go through transplant, and that's not only just physical but mental and emotional as well. So number one thing is to keep thinking about your physical activity. So anything you can do to keep yourself moving during the day would be wonderful, and even thinking about what you can modify to do in your recovery after surgery as well. So that may just be walking, it may be other things like thinking about yoga, tai chi, different things that maybe you have not explored before as well to keep yourself active. And a long physical activity exercise program like an hour, a half hour is great, but even little bits of 10, 15, even 5 minutes spread throughout your day can be just as beneficial as well. The other thing too is to think about what you're eating, so thinking of your nutrition. And I think we talk a lot about nutrition as far as preparing for transplant, even after transplant, having a healthy diet to work with your medications. But it's important to keep thinking about what you're putting in your body that's going to help fuel you during this process as well. So just being a little bit more aware of what your nutrition is. If you need some help considering that, also there's many folks available, nutritionists or dietitians that can help you with that. The other thing is to think about getting enough sleep. It's kind of that thing, we're all so busy that sometimes our sleep patterns get disrupted, especially if we're worried or we're thinking about things that we need to do in preparation for surgery, or busyness throughout the day. So the general recommendation is 7 to 8 hours of restful sleep. So restful sleep means that you're actually in the bed and you're not waking up several times throughout the day as well. Or if you're waking up in the morning and you're not feeling rested, kind of going back and considering what else you could do to improve your sleep patterns. Again, there's lots of people that can discuss different options for you to help you with your sleep as well. And with that, considering maybe there's some other things that would help with any anxiety or stress that you have, getting yourself mentally prepared. Sometimes they help with sleep as well, things like guided imagery, which is kind of like guided daydreaming, kind of helping you get to a relaxed state. The other thing, probably a major thing we talk about is deep breathing exercises as well. Number one thing to help kind of relax and kind of manage thoughts that you have. So remembering to take nice deep breaths from your abdomen, slow your breathing, kind of an easy, what we call ocean breath. Breathe in and breathe out. So times when you're feeling tense or stressed, or even if you're thinking about before you go to sleep or waking up in the morning, taking those nice deep breaths throughout the day as well. Kind of the number one thing. Other thing to think about also as preparing for surgery, even during your recovery, that may help you relax is sometimes people will go and you have massage, or they'll think about other things like acupuncture, all those, but things that you can discuss with your medical team as well. And certainly there's other people available as resources for that to tell you what would be safe or good techniques. Another thing to think about as you're preparing is looking at your thought process. How are you thinking positively about your surgery or your recovery? We'll call those positive affirmations. So it's kind of where your thoughts go is where your energy flows, what helps you move along. So thinking about statements like, I am happy and I'm healthy, or my surgery is going to go well, or my recovery is progressing. Just statements like that. They may be statements you want to write down. They may be statements that you want to share with your medical team so that everybody's thinking positively about your surgery or your recovery as well. And again, if you have difficulty thinking about some of those affirmations or thoughts that you want to have, there's other people that can help you with that also. As you're talking also with your caregiver, you may have some thoughts about when you're coming to the hospital, what kinds of things would be comforting to you. Some items you might want to bring with you. Things like even earplugs. It can be a very noisy environment in the hospital. Sometimes they can be helpful. Eye masks sometimes can help with the light that might be in the room environment. There may be music that you enjoy that makes you feel relaxed or comforts you that you might want to have available as well. But thinking about some of those things that might be comforting to you or may make your hospital environment a little bit more relaxing for you also. And then kind of all these things are things that you can talk about with your medical team as you're developing a plan for what to expect. And there are people that would work with you as either coaching you or just kind of help guiding you with some of those answers. Several different people within the medical team. Just being open to asking some of those questions, and we're happy to help you.